Welcome to today's lecture on renal cysts. In this lecture, we will discuss various aspects of renal cysts, including their definition, classification, pathophysiology, clinical presentation, diagnostic approaches, differential diagnosis, management options, complications, potential malignancy, and the relationship between renal cysts and autosomal dominant polycystic kidney disease, ADPKD. Renal cysts are fluid-filled sacs that can develop in the kidneys. They are classified into simple and complex cysts based on their characteristics. Simple renal cysts are benign, thin-walled, and have a smooth outline. On the other hand, complex renal cysts can have septations, solid components, or other features that differentiate them from simple cysts. The exact cause of simple renal cysts is not yet understood, but several theories have been proposed. One theory suggests that they arise from tubular dilation and obstruction, leading to the formation of a cystic structure. Genetic factors may also play a role, as some studies have identified certain gene mutations associated with the development of renal cysts. In most cases, simple renal cysts are asymptomatic and are incidentally detected during imaging studies. However, some patients may experience symptoms such as flank pain, hematuria, blood in the urine, urinary tract infections, or hypertension if the cyst becomes large or causes compression on surrounding structures. Imaging modalities such as ultrasound, computed tomography, CT, and magnetic resonance imaging, MRI, play a crucial role in diagnosing renal cysts. Ultrasound is usually the initial imaging modality of choice, as it is non-invasive, does not involve radiation, and can provide valuable information about the cyst's characteristics, size, and location. CT and MRI may be used to further evaluate complex cysts or to assess any associated renal abnormalities. While most renal cysts are benign, it is essential to differentiate them from other renal masses that may require further evaluation or treatment. Differential diagnoses include renal tumors, abscesses, hematoma, and pseudocysts. The clinical presentation, imaging findings, and certain features observed on imaging, for example, solid components, enhancing areas, can help differentiate between cystic and solid renal lesions. The management of simple renal cysts is primarily based on their size, symptoms, and associated complications. Small asymptomatic cysts generally do not require any intervention and can be monitored with periodic follow-up imaging. Symptomatic cysts or large cysts causing compression on adjacent structures may be treated with interventions such as percutaneous aspiration, sclerotherapy, injection of a sclerosing agent, or surgical removal. Simple renal cysts are typically benign and do not pose a significant risk of malignancy. However, long-standing or complex cysts may have an increased risk of developing into renal cell carcinoma, RCC. Close monitoring and periodic imaging are essential to detect any worrisome features or changes suggestive of malignancy. ADPKD is an inherited condition characterized by the development of multiple cysts in both kidneys. These cysts are usually larger and more complex than simple renal cysts. Patients with ADPKD may also experience other systemic manifestations, such as liver cysts, hypertension, and cardiac abnormalities. Genetic testing and family history evaluation are crucial in diagnosing ADPKD. Differentiating between simple and complex renal cysts is essential to guide management decisions. Complex cysts may have septations, thickened walls, calcifications, or solid components. Imaging features, such as enhancing areas on CT or MRI, can indicate a higher likelihood of malignancy or the need for further evaluation. The Bosniak classification system is commonly used to stratify the risk of malignancy in complex renal cysts. It categorizes cystic lesions into various groups based on imaging findings and helps guide clinical management. The classification ranges from Bosniak I, benign, to Bosniak IV, high risk of malignancy, with different recommendations for follow-up or intervention based on the category assigned. Parapelvic and parapelvic cysts are cystic lesions that arise in the renal pelvis or around the kidney. They are often incidental findings and may not require treatment unless they cause symptoms or complications such as urinary obstruction or infection. Imaging studies, such as CT urography or MRI, can help evaluate the extent, size, and relationship of these cysts with the renal collecting system. In some cases, solid renal masses may have cystic components, making it challenging to differentiate them from complex renal cysts. Imaging features such as mural nodules, irregular contours, or enhanced solid areas can raise suspicion of malignancy. Further diagnostic tests such as biopsy or surgical excision may be necessary for definitive diagnosis and appropriate treatment planning. In conclusion, renal cysts are common benign findings that can be classified into simple and complex cysts based on their characteristics. Timely and accurate diagnosis, appropriate management, and close monitoring are crucial in evaluating renal cysts and differentiating them from other renal pathologies. Understanding the pathophysiology, clinical presentation, and diagnostic approaches discussed in this lecture will aid in providing optimal patient care in nephrology practice.